nervous system fairly common in children, especially meningitis is cause fatal in children. Let's see about the meningitis. First, we are going to see about what is meningitis. And meningitis is the inflammation of protective membrane covering on the brain and spinal cord known as the meninges. The inflammation is usually caused by an infection of the fluids surrounding the brain and spinal cord. Meningitis can be a life-threatening conditions. It's a medical emergency. Inflammation and not only the brain, it also affect the spinal cord also. And meninges, let's see about the meninges. Meninges is having three layers. First one is the dura mater, and second one is the arachnoid mater, and third one is the pia mater. Let's see what is the subarachnoid space. Is the space which is exists between the arachnoid and then pia mater, which is filled with the cerebrospinal fluid. Next one is the cause of meningitis. So here the causes: bacterial infection, viral, fungal, parasitic, physical injury, cancer, certain drugs, head injury, cerebral abscess, and medullary infections that may cause the meningitis. Okay, let's see about next. We are going to see about what are the bacterial infection that may cause the meningitis. First one is the Haemophilus influenza, meningococcus, listeria, mumps, pneumococcus, certain streptococcus infections that may cause the bacterial meningitis. Next. And next, viral meningitis. That viral meningitis is caused by certain virus. First one is the enterovirus, arbovirus, influenza, herpes simplex virus, especially in infants, and then varicella zoster, HIV, mumps, measles. These are the viral infections that may cause the meningitis. And next, risk factors. Those who are under the risk of meningitis. First one is the age children, those who are under the 5 years, and then those who are taking the immunosuppressive drugs, and then chronic malnutrition, AIDS, those who are those who are having the shunt, and then chronic alcoholism, diabetic. Next, signs and symptoms of meningitis. First one is the severe headache. The children infected with meningitis, they may experience the severe headache, irritability, restlessness, neck stiffness, malaise, nausea, vomiting, high grade fever, tachypnea, which is the increased respiratory rate, and seizure, disorientation, tachycardia, which is increase in the pulse rate, and then phonophobia, these they may experience. Diagnostic evaluation, positive signs, physical examination, history collection, CSF fluid evaluation. Here we are examining the protein and glucose leukocytes, blood test, CBC, blood culture, MRI, CT we have to do. When we are doing CT, we can assess. And the next, already mentioned positive signs, is a positive confirmative test like positive Hernick signs, and then positive Brudzinski sign. These are the two positive signs. When we are doing the physical examination, we can assess it will be elicited the patient is having meningitis. And the next complication, those are having the meningitis, it may cause the brain damage, cerebral edema, hearing loss, tissue damage. And then treatment, antibiotics for the bacterial meningitis type of vary depending upon the bacterial causing infection. Antibiotics are not effective in the viral meningitis, so here we have to choose the antiviral medications. And then prevention, Haemophilus vaccines we have to put, and then pneumococcal conjugative vaccine we have to administer for the children. And then household members, if those who are infected, we have to if the in house anybody affected with the meningitis, children, they must be isolated.